Today, we will go to show you how to do the geriatric shower bath. Here are the objectives. First, to learn how to assist the patient with shower bath. To learn how to assist the patient in administrations of medicine. To learn how to serve food tray for the patient. And lastly, assist the patient in self-care or grooming. Before starting the procedure, check the patient's profile to know the previous vital signs or the diagnosis of the patient. Next, proceed to the patient's unit, knock on the door, and make sure to always greet the patient cheerfully. Inform the patient that in about 10 to 15 minutes that meal will be served, but before that, encourage the patient that he or she has to attend his or her personal needs and ask the patient what does he or she prefer, a shower bath or a tub bath. And then, check the patient's temperature and also the skin integrity of the patient. While waiting for the patient's temperature, proceed to the bathroom and prepare the materials needed. The materials needed are bath towels, shampoo and soap, towelette, grooming kit, new sets of gown, thermometer, chair with backrest, shower, toothbrush, and toothpaste, also a non-skid rubber mat. Make sure that the materials are always within reach to save time and energy. Go back to the patient's room and check the thermometer, and if the patient's temperature is at normal temperature, proceed to the shower bath. Make sure to disinfect the thermometer before and after use. Keep in mind, if the patient has fever, do not proceed on the shower bath. Give the patient a tepid sponge bath instead. Assist the patient to the shower room by putting the patient's hand on the caregiver's shoulder. Let the patient sit down, remove the gown, check the gown for any personal belongings, roll the gown and put the used gown onto the laundry hamper. Before bathing the patient, you must check first the water temperature. The water temperature should be at least 30 degrees to 40.5 degrees Celsius. You may also let the patient to feel the water to make sure that the water temperature is enough for him or her. You may then adjust the water temperature depending on your patient's preference. Check the emergency call buttons. Teach the patient how to use the call button if he or she feels dizzy or not feeling well. Instruct the patient not to play with the emergency button as well. Please inform the patient as well that gadgets or any form of electronics are not allowed inside the bathroom. This is of course to prevent electrocution. You may point out availability of the handrails and if they are working. Non-skid rubber mat should also be placed on the floor near the patient's stool. This is to prevent the patient from slipping. Explain to the patient why the bathroom door is never permitted to be locked, so in cases of emergency we could enter the room right away. Get a towel and put some liquid bath soap on it. You may then ask the patient if he or she wants you to rub his or her back. This may be done in a circular motion or in a longitudinal stroke. Please do remember, do not do all the things that the patient can able to do to promote independency. Remember as well to close the bathroom door for the patient's privacy. While waiting for the patient to finish, you may then prepare or fix the patient's bed and prepare the food as well. And also prepare the prescribed medicines to be taken. And also help the patient to pat dry the body as well as the head. Assist the patient in going back to the room. And dress the patient with new sets of clothing. Ask the patient if he or she wants a gown or a robe. Remember to check the patient's temperature again. Do grooming, comb the hair, apply lotion or powder. Also ask the patient if he or she is allergic to any form of skincare. And also check the fingernails. Just trim the fingernails if they are long. Go back to the thermometer. If temperature is normal, procedure is successful. But if the patient had fever, include it on your documentation. Give the patient's meal. In serving food consideration, before you serve the hot food, inform the patient. Make sure that the food is prescribed by a dietitian. If the patient is partially blind, use a white plain plate without design. And if the patient is blind or totally blind, teach the clock method. Remember, if the patient is partially or totally blind, never give a knife. Also, the plate should be at least 1 inch away from the edge of the table. If the patient is already done eating, do aftercare immediately. Wash your hands before giving the prescribed medicines and prepare all the materials needed as well. In serving oral medication, you'll need a glass of water, syrup, table of vitamins, medicine cup, and suspension. For tablet or capsule, serve them individually. Put the capsule or tablet onto the palm of the patient and serve with water. For liquid medication or syrup, no need to shake, just pour, except for suspension liquid medicine. Place your thumb on the desired measurement, then pour. Remember to pour on the unlabeled part of the medicine bottle to prevent the ruining of the label for easy identification. For suspension liquid medication, shake first. Then for accuracy of measurement, put the medicine cup on a flat surface on eye level. Remember, do not forget to check the expiration date of each medicine being given to the patient. Considerations in oral medication: observe for any side effect of the medicine, observe if it is effective or not effective. If the patient is diagnosed with mental illness, check the patient's mouth just to make sure if the patient took the medicine. Open the patient's mouth, then check under the tongue and left and right cheeks. Also, medication should always be given on time. After the patient took his or her medication, provide aftercare. And also, you may ask the patient if the patient would like to do oral care. You may change the patient's bathrobe to a much more comfortable one, put the patient back to the bed, or ask the patient if he or she wants to do something else. After the procedures are done, do the aftercare, wash hands, and do your documentation. Document the latest vital signs, all medications given, and the side effects manifested by the patient as well.